We have seen a virus-stricken cruise ship has finally docked after being stranded off the coast of California for 5 days. Back home, there are calls for cruises to be suspended, with one Queensland professor labelling the ships as virus incubators. Joining us now is that professor, the infectious diseases expert from Griffith University, Nigel McMillan. Nigel, appreciate your time. Are ships really any worse than hotels, schools, sporting grounds, concert venues? Where do we draw the line here in terms of places we should be avoiding?
Yeah, thanks for having me. Cruise ships are really a different scenario because people are really in such close quarters, and of course if you're isolated in those close quarters, you really don't have places to move about. I don't think I'd like to be quarantined in an internal room in a cruise ship for 14 days. We saw how the Diamond Princess passengers responded to that, some of them breaking quarantine. And what I'm really calling for is the cruise ship industry to really rethink their model right now. It's quite a different situation to hotels or even aeroplanes, sporting events, etc., which are really quite short term.
We still seem to be learning more about the virus all the time. What is the latest in terms of what we know about how it's spreading, who's being worst affected, why children don't seem to be suffering? What's the latest advice that you're seeing?
Well, most of it hasn't really changed in the last sort of week or so. We know that there's been no deaths in children under 9. People under 30 are still quite resistant to this. They don't seem to suffer much at all, and that really our older populations are the one at risk. And I guess the point to make is that for Australia, while we still have these isolated cases and we really just have these embers burning rather than a raging bushfire, we can control this disease. And if we can see from the example of Singapore and even China that the measures that we're taking, which are really world leading as well, will allow us to control this disease as long as we don't let it get out of hand and as long as everyone does the right thing in terms of isolation. And we've seen a couple of noted instances where people haven't followed the rules, and this is really just a recipe for disaster. And most of all, we want to keep it out of our old people's homes. Really, that's our most vulnerable population, and we need to protect them as much as possible.
So when we're talking about aged care homes, we're talking about schools, places where there are real fears that the virus could spread and spread quickly, should the government be getting further out in front here in terms of ordering schools to close down? I spoke with the AMA WA president last hour, and he was suggesting this needs to be something the government considers sooner rather than later. If you were setting health policy, what would your advice be on that front?
Yeah, look, schools are an interesting situation because contact tracing, which we'd normally do with patients, is so difficult in a school situation, who's seen who in close quarters, etc. I think this is a very dynamic situation, and I think that the next step, if this thing starts getting just a little bit more widespread, is that we will definitely need to be thinking about closing schools and universities for that matter as well, once it's really spreading out in the public. We still have a window of opportunity, and really on a case-by-case basis I'd be looking at whether school closures are required, and certainly if there are infected students proven to be, then I would certainly be closing that school. And I think that's just best practice, and you can see that's exactly what's occurring in Italy and other places around the world. We really need to sort of get ourselves on top of this as much as possible, because the work we do now will pay us off in the long run without having widespread illness from this disease.
But is it too early to take that step as a preventative measure before cases are diagnosed in a particular school or aged care home?
Yeah, look, I think so. I think that we're not quite there yet. But I mean, for example, in aged care homes, banning visitors or reducing visitors and screening is a very sensible step to actually take. But if you have infected staff or students in a school, I'd close that particular school. But to blanket sort of close all schools in the country, I don't think we're quite there yet. We're not seeing the sort of situation we see in Italy where they have 8,000 cases, etc., and it's really quite out of control in that situation. And of course this is what can happen when you don't take the sorts of measures that our government are taking right now.
As you say, we're really at the start of the journey here in Australia. What can we learn from the China experience? Should we be taking hope from the situation there that we have seen the number of new cases and deaths really tapering back in recent weeks, or can we not really be sure that data is totally reliable?
Well, whether you look at the Chinese situation where their sort of peak was around the beginning of February, and we can see case loads now coming down below 100 a day, but we can even look back at the SARS epidemic where we could see that the sorts of practices that we had then, which was that isolation, resulted ultimately in that disease snuffing itself out, and we didn't see it again. So we know the practice works. It's just a matter of making sure that we instill it in everyone and everyone obeys the rules, and ultimately that will allow us to see this disease off. Otherwise, it'll just become endemic and it'll just become another virus that we see, and then there'll be a number of deaths around the world in the meantime if we don't control it.
And how much does that risk increase as we get into the colder months and we do start to get the usual range of cold and flus on top of coronavirus? How would that affect us in terms of already having a weakened immune system? Is that really the danger zone health authorities are worried about?
Well, I think we're worried about the normal flu season now sort of looking to peak in about the same time that our own coronavirus caseload will peak in around April and May, and so we want to avoid that for sure. It's not really sure yet as to why or if this particular virus will do much better in the winter compared to the summer. UV light, for example, is a great sterilant. You know, it stops this virus in its tracks, so summer's normally much harder for the virus to survive. But we really want to make sure that people get their flu vaccines early. I called for this 10 days ago, and I think that, you know, the authorities are really acting on this. We don't want double infections. Once again, our very elderly are susceptible to influenza, and of course our very young are susceptible to influenza as well, although they seem pretty resistant to the novel coronavirus here with COVID-19.
And what about health workers? I have seen suggestions that people with a high and repeated exposure to the virus, like those frontline health workers, are in some cases getting more severe cases of the virus, and that was the experience in China, I understand. Is that being borne out by the data? Is that something that you know, there is a real focus on in terms of the health response here at home?
Yeah, look, so health workers always are exposed to these sorts of things, and this is just part and parcel of being a health worker, no matter whether it's HIV or whether it's this particular viral disease. But the health authorities and the hospitals spend a lot of time and effort in terms of infection control training, and our workforce is really highly trained. They have all the resources they need to handle this. And so the only thing we're probably not doing, perhaps, that we might need to think about, I've seen overseas, is this interesting concept of drive-through coronavirus testing, where patients are swabbed in their cars like a McDonald's drive-through, and the results will come back to them 24 or 48 hours later, and this reduces the exposure. But the fever clinics that everyone's setting up, even as I understand, even in some GP practices, is going to be a good way to avoid exposing the general patient population to those who might be suspected of having coronavirus.
Yeah, I think in South Australia they might be onto that plan of the drive-through testing. I saw some reports about that a bit earlier today, so maybe some of the other states need to start considering that move as well. When it comes to people sitting at home, they haven't been overseas, they get a sniffle, how important is it that they get tested for coronavirus if they don't consider themselves to be in the at-risk group?
Yeah, I mean, look, I guess we've seen the situation, I guess, with the doctor in Melbourne around, you know, a pretty mild illness, and really he didn't consider himself at risk, although he had travelled, and resulted in that situation. And of course we would hold our medical workers to a higher standard. But look, if you've got a sniffle or a cold, I want people to stay at home. They should isolate themselves anyway. If you get the sort of classic signs, so this is particularly the fever, the dry cough, then go and get yourself tested. No one's going to stop you getting tested. We're doing lots and lots of tests all over the country right now, and they're better to be safe than sorry. And if you do turn out to have COVID-19, then you know you're going to get 14 days at home and hopefully not a visit to hospital. So no sniffle is too small to worry about, but this just really reinforces that our general rule should be, if you're not well, don't go to work. We don't need heroes at work, and we don't need them spreading the disease around. And one of the examples, I guess, is apparently the benefit from undertaking this sort of advice is that in the Northern Hemisphere, their influenza virus season seems to have been a little less worse than usual. So there might be an added advantage to people heeding what we would consider normally good advice anyway.
A small silver lining in the scheme of things. When you're talking about people staying at home, those at-risk groups, the people who maybe already have some form of a respiratory problem, should they be self-isolating at this point? Is it too early for them to say, well, look, it's time for me to stop going out in public, stop going to work? I mean, is that the level that we need to start looking at?
So I think that those who particularly have these comorbidities, who might have a poor lung or immune function, I think that now's the time to start thinking about those social isolation practices, the distancing. So not that you don't go out, but just take a little bit of extra care, so that is, not perhaps getting right up in people's faces or working or being in crowded areas. If they wish to stay at home, of course, they can make that choice themselves, but choose your level of risk. We're not really at the stage yet where this is so widespread and circulating in the community that you would avoid doing something like that. But for those that are particularly at risk, they might want to think about this just a little more carefully.
Infectious diseases expert Nigel McMillan, appreciate you joining us with your insights. Thank you so much.